Okay, we're sitting here with Barbara Stevens. She was involved in a motor vehicle accident on March
5th, 2005.
2005. She had been seen by a few doctors before seeing me, having had a lot of problems with her neck and her low back. And after I first started seeing her near the middle to the end of 2006, we'd found out that she actually had sustained a pelvic insufficiency fracture, and she had significant stretching of her sacroiliac nerve, developing in her sciatic nerve, and she had a lot of problems with walking. She had to wear high heels to walk anywhere, had a lot of problems with moving, climbing. What other kind of things did you have problems with?
Well, doing just about anything. Sitting. I had problems with, well, especially making a bed, doing the regular housework. I had trouble standing at the counter, even just slightly leaning forward to do dishes was nearly impossible. It would cause so much pain. It was unbearable. I would have to lay down. I could be up for probably an hour or two, maybe.
And you were taking a lot of pain medications back then, too.
I was. And then, and I did that just for the sake of my family. My mom would tell me sometimes I'd forget to take them, or I wouldn't want to take them, and so I try to ride the pain out. But I would get so irritable with my family that my mom would remind me, you need to go take some pain medication, just to protect my poor family. But yeah, it was kind of.
There were some tough times there.
It was intense. It was. I can't remember the last time that I went through a day without throwing up. You know, before I started to get better, but it was, the pain was so severe I would just throw up and throw up and throw up. It was terrible.
And what are some of the kind of treatments that we've already put you through before you found the right combination to work with you?
Well, the significant things, when I first came to you, you diagnosed the bulge discs in my back, and you sent me to what was his name? Eisenfeld, Dr. Eisenfeld. Yeah. And he did epidurals. He did two series of epidurals on my low back. And I noticed a significant difference with that. That was the first time that I really noticed a significant difference in the relief of some of the pain.
And then,
but it still wasn't enough to keep me off the pain medication. If I stayed off the pain medication, then the pain would still become so severe that I would end up throwing up or whatever. So I still had to take the pain medication in order to function. I would spend probably 6 hours a day in bed. It was terrible.
Yeah, it's a big difference for you too. And one of the things you like to do is interior decorating.
Oh yes.
And
yes.
I know that's
my passion.
It's one of the things you enjoy doing.
Definitely.
And I think we also finally did some ultrasound imaging to find they had the sciatic nerve inflammation, stretching, and irritation. And did a lot of different physical therapies, trying things that worked. Some things worked, some things didn't.
Right.
And then we hit on a good combination of the acupuncture and the cold laser.
Right. And then that's when I noticed the next significant change in my pain level.
Okay.
After you started doing that, it was pretty much immediate. I think it was after the second or third time, wasn't it?
Yeah, about that. You started having a lot of improvement.
Yes.
I think you only need to do about 4 or 5 treatments total.
I'm not sure.
And I know it was under 10, somewhere under 10 treatments.
Okay.
And your walking improved. You still needed to wear high heels for some things.
I had difficulty wearing flats.
Mm-hmm.
Still, even at that point.
And then the biggest change you noticed recently was when you started on the mangosteen.
Right.
And the high antioxidant.
Right, through Zango. I started on the mangosteen juice, and because you've always talked to me about nutrition, and you always asked me what I was eating, and stuff like that. So I just kept having to keep searching and keep finding until I found the right combination.
Okay, let's go ahead and take a look at your range of motion now. What you can
Okay.
do. And
okay, how do you want me to do this?
Well, actually from the side.
From the side. Okay.
Yeah. So you can actually go ahead and bend forward now. And you still have a little bit of a catch up in here when you bend forward.
Oh, do I?
Yeah. That's still not a lot better, and the fact that you can actually reach down to your toes is pretty good. And then go ahead and bend backwards.
Okay, backwards.
I guess. Take off those sunglasses. Almost a full back bend.
I can go into a full back bend, but I have to put my hands over them.
That's amazing. And then the side bending is really good.
It's not as flexible as I used to be, though.
Right.
But the flexibility is there, and I can work on it over time. And the side.
Mhm.
See, I can come down to here so far.
That's amazing.
I think if I stretch out more and get more flexible again,
You could probably do more.
then I'll probably be able to do more. But I'm still doing it very slowly because I don't want to injure myself
Exactly.
anymore and lose.
Yeah.
I don't want to lose anything of what I've gained. So
And so the main things you're just avoiding now is mostly the twisting activities because you don't have the stability and the strength for twisting.
is that what it
activities.
is?
It seems more of a strength and a stability.
Because I
combination.
still get that catching that if I twist and apply pressure, like see, I can
Right.
twist like this, and I can turn like this, but I'm feeling it all back in there, and
Right.
that tells me to be cautious with that. If I try to apply pressure with that, like as in making a bed, scrubbing a floor, or the sweeping, because the sweeping is that same twisting, you apply pressure with the broom.
Right.
But I can do the twisting like this, which I could
That's
never
amazing.
do before.
So it sounds
couldn't-
mostly like a little bit of the disc issues left, but you know
Yeah.
you've made some amazing progress and you feel really well.
Mhm. And every once in
Very
a while,
impressive.
I'll still feel something shoot down into my toes.
Okay.
Oh, and my toes were locked up before too.
Yeah, and she has better formation of her toes, a little bit
They're
better
not as
strength. And,
curled up as they were.
yeah. She still doesn't have a lot of grip strength for plantar flexion on her toes,
Yeah.
but it's definitely a lot better.
Yeah, because I've sprained my ankles several times going this way. Not in high heels, you know,
But
amazingly enough, but in flats.
Yeah, and you're wearing heels now, but you can actually wear flats now if you want.
Yeah, I can. I can walk barefoot.
Well, thanks.
Thank
That's
you.
really good doing it.
Well, thank you so much for all that you've done for me. I appreciate
very
you.
cool.
I
I'm
really
very-
appreciate you.
Thank you.
Thank you so much.